Coming up in today's video, guys, I've got two pediatric patients. The theme of today's video, they were both in a lot of pain, which is why they came through to see us today. My name is Rhys. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and I am the other audiologist here. And we're going to explain. I forgot how to do this bit. We're going to explain.
Get my cut.
Little parts of the procedure. We're just going to briefly explain, kind of, what Rhys is doing and the reasons why we kind of do these certain things. But typically pediatrics, I can't do pediatric appointments, just purely because of my qualification. But it's all Rhys. So yeah,
all kids
same sort of procedures.
It is, similar kind of thing. So this first patient here, what we're doing now, the theme of this one is basically pain. I've got two pediatric patients, both of which were in a lot of pain recently with their ears. I've been to see the GP. GP said there's too much wax in there for them to do anything about. You need to get that removed first before they'll treat. And they've come through to see me. So this particular patient here, this ear canal, actually pretty good. Not too bad. I can see the eardrum here. Everything looks healthy. The skin of the eardrum looks good. The eardrum itself looks fab. A little bit on the dull side, but that's fine. But this is a side they were getting a lot of pain with, and this pain has been rumbling on for months. Okay, so intermittently painful, not painful. They were querying possible mastoiditis at one point, which is where you get an infection in the bone behind your ear. But yeah, been treated with antibiotics, but still really, really struggling. And this was mush. And I thought, well, it's just very, very soft wax. I can kind of work out what's going on here. But then when I started to lift, I'm starting to notice that it's not just wax. So what we've also got in here is plates of keratin, okay? And it's really deep. Like, I'm holding on to this with the suction tube here, trying to lift him and kind of cajole him out of this space. But look at that.
Oh, bless him.
That's not nice, is it?
As well.
They were having some real kind of issues on this side, and like lots of referred pain kind of down into the jawline, just below the ear, which is a really common thing with wax. So, if you do start experiencing, a bit of discomfort in the ear, it's traveling down here, down into there. Sometimes it'll go up to your temple as well. It's to do with the nerves that pass through the the nerves that pass through the ear canal. You get altered sensation here. So it's a good indication sometimes something's pressing where it shouldn't be. But look how deep that skin is. It's right down on top of the eardrum. And they were really struggling, bless them, with this. They were in a lot of discomfort. And I was saying, well, look, is it worse for any reason? They said, yeah, as soon as I get, I've got to put my cup down there. As soon as I get my ear wet, it becomes a lot worse. So what's happening, the water's getting in there and kind of softening the skin, and everything's kind of being expanded, and it's all trapped in this anterior recess there. So yeah, absolutely
it's like jam-packed in there. Layers and layers, as you said.
Yeah. It's all in that corner as well. So imagine like putting a bit of pressure on the eardrum, putting pressure on the skin, on this bony, osseous portion of the ear canal, so putting pressure on there as well. It was a real tough old one to do, and not an easy visual as well.
This looks like they've used quite a bit of oil or drops.
Yeah, so they'd used, they'd gone from the antibiotics. They had actually had it cleared out by ENT once. But they used a lot of antibiotics. They were also using a lot of oil and stuff, which, because the GP had basically said you need to use some wax softener to get this out. But that's just made things worse with that skin. So I flooded it with oil now because I've got to pull all this out of that recess. Yeah, you can see how it's all just pressing. Yeah, and this little one was so good. At one point, when I'm getting down this steep, because you kind of, when you're doing this, you've got an eye on the patient, kind of, an eye on what you're doing, and a half an eye, kind of, you're going to awareness what the patient's doing. And I saw a little hand, bless her, and she went, and she should have just held on to the side of the chair. So I stopped what I was doing. I said, "Lovely, you okay?" And she was going, "Yeah, I'm okay." She said, "It's just, I'm afraid it's going to hurt because my ears are being in so much pain." I was going, "I promise I will look after you, my lovely. You'll be okay." And we did manage to get everything out, I'll just say. But she was so good. She was such a good kid. Fair play to her.
Oh, and it's very difficult to get out of that area anyway.
It's the angle. It's the angle. The skin is kind of folding away from you. But look at all that.
Look at that.
No wonder she was having so much pain, bless her. And there was lots being discussed. We're looking at a kind of mastoid infection. And really, it was just everything was so deep and clustered in there.
And again, if that was harder, if that, before the drops, that's probably why they were getting so much pain. If the wax was very, very hard, and it's a very sensitive area as well.
Massively so.
Yeah,
massively so.
Oh.
So I'm eyeing up that eardrum now, and I discussed this with the members yesterday on a video. With pediatrics, I'm not a massive fan of staying down near the eardrum too long. In this case, I had to get into that recess to get this out. And because it was skin, irrigation wouldn't have broken that down. You might have flushed some out, but if it's holding on, it just won't go anywhere. So I'm trying to clear, because ideally I want this a little bit clearer. So I'm trying to stick with suction. You can see a little tiny kind of movement there as just a little bit of a flinch. So I'm just seeing if I can get this one section, but it's too deep. So what I've done, I've actually irrigated. All right, I've got rid of this. So I've irrigated, and what you can see now is looking a lot clearer. Patient almost had an instant relief. That dull, nagging ache that had been in there had disappeared. But I've got them to use a little bit of ear calm for a couple of days. 3/4 of an inch on that one, guys. And that's
2 centimeters.
Yeah, it was a bit of a beastie. Now this very similar scenario, but this was a little boy this time, and he's come through. He's been getting basically quite a bit of pain as well, and he was so nervous, just literally just really quiet. I do try and chat with the kids and make sure they're doing okay, find out something they enjoy, chat to them about it when they're doing it, just to put them at rest and at ease. But he did do really, really well. But every time I took it out, I was saying, do you want to see what came out? So I was showing him, and he was shocked by just how much was coming out of his ears.
It's difficult when someone's not had it done before, because you don't know what to expect. It's just why these videos are quite helpful to some of those patients, because they can see how it's done before coming in. But there's been a few occasions. Luckily, I haven't had it for a long time, but there's been a couple of occasions where I haven't even started, and the patient's sitting there shaking, sweating, just so nervous about having it done. I think there was even one gent who just said, like, I can't do it. I literally can't do it.
I remember that gent.
And ended up just walking out. And we just had to suggest just sticking with oil, because he just didn't want to have it done. He was so nervous, just couldn't sit there. So, which, it's fair enough. I can see where they're coming from. Never had it done. Yeah. But I say, once you have it done that once, and you can see how it feels, as long as it's done properly. So, go to someone who's obviously trained, and not just a day course, and is a beautician, and can do it at the back room for you. And
always check the background to your practitioner, guys. It makes a massive. We were talking yesterday about the gent that you saw that had a perforated eardrum that was being irrigated. Oh my words, the worst thing you can possibly do. It's a contraindication to irrigation. You shouldn't be doing it. It can cause no end of complications. So always double check the background of your practitioner, guys. All coming away really, really well. He's done brilliantly. We've got all of this kind of bulk of these hard pieces out. You can see there's a little couple of dots on the eardrum there. What I don't want to do, irrigation can feel, it's not painful, but it can feel a little bit uncomfortable.
Yeah.
Now, if I've got kids who are super nervous when they come through, if they've got a couple of dots left on the eardrum, normally, and they're really nervous, I'll say, look, just leave it there. I won't irrigate it. Just use the drops. They'll come off naturally over the next couple of weeks. Yeah. We really don't want to push them out of the comfort zone too much, because I want them to come back. I want them to have a nice experience and really look after their ears as well. But it's all coming away really well now on this one.
And the little ones get a nice little certificate from us as well when they've
they've had
their wax removed.
The ladies on the front desk started doing this, where they would print off little certificates from all when they came in, and they laminate them all with all their favourite stuff on. So they've been doing really well with that. But this one, it kind of fought me a little bit. I was going, we get the worst one done first. This one doesn't look too bad, but it's stuck. It just won't budge. It just won't come out. So I've flooded it with a bit of oil now, just to give us a bit of leeway, a little bit of lubrication inside the ear canal.
That's a difference. A little bit of oil.
It doesn't have to make a difference. Yeah, with these harder plugs. I think it's
the narrow.
It's the shape of the little one. Yeah. But he was happy with this now, and his mum said to me, "Is that better?" He was going, "I can hear so much, Mum." It was like so much coming through. Love him, but he did a fab job for me. He was very impressed with the YouTube silver plaque as well. He was like, "You on YouTube?" I was like, "Yeah." So we're 7, 8, 7 inch. I'm going to go on that one.
Yeah, just over 2 centimeters.
Well, guys, don't forget, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe for me if you really like them. Go back and check out the 1,200 odd back catalogue of videos. Check those out. I am going to put a recommendation up in the top corner here for you as well when I upload this to YouTube. So if you're watching on YouTube, you can check that out. Until next time, guys, as always, take care of yourselves.
Take care of your ears.
And take care of one another. And myself and the lovely Mr. Taylor Green. We'll see you again real soon. Bye, everybody.
Bye-bye.